The other end of the spectrum is the patient who's got augmented renal clearance, actually a sort of superhuman amount of GFR. And for years we talked about, does this exist, does this not exist? Every once in a while you'd find something that maybe this was true. And the fact of the matter is there's a fair number of patients who have augmented renal clearance. They've got GFRs that are 250 milliliters per minute, where the normal is maybe closer to 100. And we underappreciated this for years. But there are patients in the intensive care unit who have this, and there have been studies that have looked at every patient who comes into the intensive care unit and measuring actual creatinine clearances by urine and so forth to see, in fact, what are these patients' GFRs. And there's a substantial fraction of patients who have augmented renal clearance, or ARC, and their clearances can be 200 milliliters per minute. This has implications on drug clearance, and perhaps we need to dose more aggressively for drugs that are renally eliminated. Whether or not the presence of ARC has anything to do with patient outcome is really, for every study you can find that says that it does, you can find another study that says that it doesn't. But it stands to reason that if you're getting rid of antibiotics faster and antibiotic serum concentrations may be lower, that's a problem. So the risk factors, who you should have in the back of your mind is this person might have acute or augmented renal clearance, would be patients who tend to be younger. Patients, so when I say younger, less than 50 years of age. Patients who don't have any other organ failure. So if they're sort of otherwise healthy kind of folks, but they have something that brings them into the surgical intensive care unit, and in fact the surgical intensive care unit is a place where we see a lot of this, you ought to have it in your mind, I wonder what this patient's GFR really is. And it might be worth something like a measured urinary creatinine clearance, just to see that this might be a person who's in front of you who's got a very rapid renal clearance, and maybe I need to dose my drugs differently.